Welcome to this comprehensive overview of basic pharmacology concepts essential for NAPLEX exam preparation. This presentation will cover key principles of pharmacodynamics, pharmacokinetics, therapeutic drug monitoring, pharmacogenomics, dose-response relationships, bioavailability, and the first-pass effect. By mastering these fundamentals, you'll be well-equipped to excel in your NAPLEX exam and provide optimal patient care in your future pharmacy practice. Pharmacology is the study of drugs, their sources, chemistry, interactions, and effects on living organisms. Understanding pharmacology is crucial for effective clinical practice and passing the NAPLEX exam. Key areas include pharmacodynamics, pharmacokinetics, drug-receptor interactions, and therapeutic drug monitoring. Pharmacodynamics studies the biochemical and physiological effects of drugs on the body and their mechanisms of action. Key concepts include drug efficacy, safety profile, and individualized therapy based on patient-specific factors. This is crucial for determining appropriate drug dosages, predicting therapeutic outcomes, and minimizing adverse effects. Drug action principles include receptor binding, signal transduction, dose-response relationship, and therapeutic index. Drugs exert effects by binding to specific receptors, initiating signal transduction pathways, and producing cellular responses. Understanding these principles helps in determining the effective and safe dosage of drugs. Receptors are classified into G-protein coupled receptors, GPCRs, ion channel receptors, and nuclear receptors. GPCRs transduce extracellular signals through G-proteins, ion channel receptors control ion flow across cell membranes, and nuclear receptors act as transcription factors regulating gene expression. Dose-response relationships can be graded or quantal. Graded dose response shows a continuous range of effects with varying doses in a single subject, while quantal dose response determines the percentage of patients achieving a specific effect with different doses of a drug. Key parameters in dose response include EC50, Emax, and therapeutic index, TI. EC50 is the concentration of a drug that produces 50% of its maximum effect. Emax is the maximum achievable effect. And TI is the ratio of toxic dose to effective dose, indicating a drug's safety margin. Agonists and antagonists interact with receptors to produce or inhibit responses. Full agonists activate receptors for maximum response. Partial agonists produce submaximal responses, and antagonists block receptors, inhibiting endogenous substances' actions. Pharmacokinetics involves the ADME process: absorption, distribution, metabolism, and excretion. Absorption is the entry of the drug into the bloodstream. Distribution is the dispersion throughout the body. Metabolism is the biotransformation into metabolites. And excretion is the elimination of the drug from the body. Drug absorption mechanisms include passive diffusion, active transport, facilitated diffusion, and endocytosis. Passive diffusion is the most common, moving drugs from high to low concentration without energy. Active transport requires energy, facilitated diffusion uses carrier proteins, and endocytosis engulfs drugs into vesicles. Factors influencing drug absorption include drug solubility, pH and pKa, surface area, blood flow, and first-pass metabolism. These factors affect the rate and extent of drug absorption, influencing its bioavailability and therapeutic effectiveness. Volume of distribution, VD, is the ratio of the amount of drug in the body to its plasma concentration. High VD indicates extensive distribution into tissues, while low VD suggests the drug remains largely in plasma. This concept is crucial for determining dosing regimens. Factors influencing the volume of distribution include lipophilicity, molecular weight, ionization state, and protein binding. Lipophilic drugs distribute widely into tissues. Smaller molecules cross cell membranes easily. Non-ionized drugs affect VD, and high protein-bound drugs have lower VD. Drug metabolism involves phase 1 and phase 2 reactions. Phase 1 reactions include oxidation, reduction, and hydrolysis, primarily mediated by cytochrome P450 enzymes. Phase 2 reactions involve conjugation with endogenous substrates, increasing water solubility for excretion. Drug excretion occurs through renal and hepatic routes. Renal excretion involves glomerular filtration, tubular secretion, and reabsorption, influenced by drug ionization and blood flow. Hepatic excretion involves bile secretion and enterohepatic recycling, prolonging drug effects. Pharmacokinetic parameters include half-life, clearance, and bioavailability. Half-life is the time for plasma concentration to reduce by half. Clearance is the volume of plasma cleared of the drug per unit time, and bioavailability is the fraction of administered drug reaching systemic circulation. Drug-drug interactions can occur during absorption, distribution, metabolism, and excretion. Examples include antacids reducing tetracycline absorption, NSAIDs displacing warfarin from albumin, ketoconazole inhibiting CYP3A4, and probenecid inhibiting renal secretion of penicillin. Therapeutic drug monitoring, TDM, involves measuring drug concentrations in a patient's blood at designated intervals to maintain therapeutic levels. It ensures optimal dosing for patient outcomes, especially for drugs with narrow therapeutic indices or significant pharmacokinetic variability. The TDM process includes patient assessment, drug selection, sample collection, laboratory analysis, interpretation, and dosage adjustment. This systematic approach ensures accurate monitoring and effective dosing adjustments based on patient-specific factors and therapeutic ranges. Pharmacogenomics studies how genetic makeup influences drug response. It tailors drug therapy to individual genetic variations for optimal efficacy and safety, enhancing drug efficacy, minimizing adverse reactions, and guiding drug development for targeted therapies. Understanding the basic genetic concepts in pharmacogenomics is essential. DNA and nucleotides form the building blocks of genetic information. Chromosomes and genes are tightly coiled structures encoding proteins. Alleles and genotypes represent different forms of a gene, while phenotypes and haplotypes are observable characteristics influenced by genotype and inheritance. Pharmacogenomic markers play a crucial role in drug metabolism. For instance, CYP2C19 and clopidogrel affect clotting, while CYP2D6 and codeine influence pain relief. HLA-B5701 and abacavir indicate hypersensitivity risk, and TPMT and azathioprine impact myelosuppression. Various techniques are used in pharmacogenomic testing. PCR amplifies DNA sequences, while DNA sequencing determines exact nucleotide sequences. Microarrays analyze thousands of variants, and whole exome sequencing identifies rare variants in protein coding regions. Pharmacogenomics has diverse clinical applications. In oncology, trastuzumab targets HER2-positive breast cancer. For cardiovascular disease, CYP2C19 polymorphisms affect antiplatelet therapy. In psychiatry, CYP2D6 variants influence antidepressant metabolism, and in pain management, they affect opioid dosing. Pharmacogenomics raises ethical, legal, and social concerns. Ethical implications include privacy and informed consent. Legal implications involve protections against genetic discrimination. Social implications highlight health disparities and the need for public education. Understanding dose-response relationships is crucial. The definition involves the correlation between drug dose and biological response. Graded dose response assesses effects like blood pressure, while quantile dose response determines the percentage of subjects experiencing specific effects. Bioavailability is the proportion of administered drug reaching systemic circulation unchanged. Key factors include first-pass metabolism and physiological conditions. The clinical importance lies in guiding dosage and adjustments for optimal therapeutic effect. The first-pass effect involves the rapid uptake and metabolism of orally administered drugs by the liver, reducing bioavailability. Examples include propranolol and morphine, which undergo significant first-pass metabolism. Strategies to overcome first-pass metabolism include alternative routes like transdermal or IV administration, prodrug formulation, enzyme inhibitors, and nanoparticle delivery to protect drugs from metabolic enzymes. Mastering basic pharmacology concepts involves comprehensive understanding, clinical application, continuous learning, and NAPLEX preparation. Integrating pharmacodynamics, pharmacokinetics, and pharmacogenomics is crucial for success.